On this Global Challenges, robo-surgeons.
Nobody has ever come up with this particular concept of having the machine actually implanted.
Well, now a team in Nebraska has. Their innovation could retire the phrase, going under the knife. Hello and welcome to Global Challenges. I'm Shihab Ratansi. We're in Omaha at the University of Nebraska Medical Center, a place of learning, a place of healing, and somewhere to meet a new type of surgeon. It's dexterous and yet small enough to be inserted inside your body. Meet the robo-surgeon. What if you could swallow a swarm of microscopic robots that would roll through the passageways of your body, sorting out any medical needs you may have? A gallbladder removal here, perhaps a heart bypass there, all without any skin being broken, and so all with the minimum of recovery time. It may seem like the preposterous vision of a mad scientist, but there are those who say it will happen. Well, we're not there yet. In fact, as far as robotic surgery goes, these are the sort of machines currently in use. Huge, hulking machines with all the surgical implements on the end of robotic arms, which means you still have to be cut open, although less so than in traditional surgery. Current medical robots use the same principles of keyhole surgery that have been widely practiced since the 70s. The surgeon cuts several small holes into a patient's body. A camera is inserted into one incision, surgical instruments in the others. Each tool is connected to a tireless, shake-free and precise robotic arm, which the surgeon manipulates at a distance. All marvelous for accuracy, and because the incisions are so much smaller than for conventional surgery, recovery time is shorter. But the process is cumbersome and inflexible, the robot's expensive. Some say for all the technical sophistication, in the end it's just surgery performed with long, expensive sticks. Enter our mad scientists. Except far from being delusional, they've actually built what they say are the next generation of robotic surgeons. Small, remote-controlled machines that will roll around on wheels inside us.
Nobody has ever come up with this particular concept of having the machine actually implanted. Everybody's always thought, well, how can we reach inside with something? Well, we're saying, well, we don't want to be reaching inside. We want to be placing the entire machine inside.
See, I'm watching the robot screen, not this screen right here.
Dr. Dmitry Oleynikov is a surgeon at the University of Nebraska Medical Center. His prototype machines have already successfully been used in surgery on dogs and pigs to remove gallbladders and prostate glands.
Turn one backwards and the other one forward, and it will turn.
Dr. Farritor is the engineering brains behind the little surgeons. He was one of the researchers who helped create the Mars rover.
Both Mars and surgery are very different than the world you and I exist in. The mobility problem, you basically want to do the same thing. You want to rove around and you want to return video images and sensor information back to the surgeon.
But a surgical robot has different priorities to a Mars rover. First, how to do no harm while keeping a grip on all terrains.
Driving around was a big problem. It's hilly in there, it's soft, it's very slick inside the abdomen. So that's made a very challenging engineering problem, creating wheels that would drive inside the abdominal cavity.
This is on top of our organs?
This is on top of the organs, on top of your bowel and your liver and those kinds of things, yeah.
The doctors say they've solved that problem. So from this, we reach this.
What you have to do is put your hand on the joystick, and if you gently push it forward,
there you go,
and then backwards, it allows you to control the robot.
How do I do a turn? Oh, there we go. I'm a natural.
Absolutely. just a bit of practice at your local video store.
Well, I mean, that's the point. I mean, the technology doesn't seem that advanced. It seems like the same sort of thing one would see in a children's toy. So why is it taking so long to figure out then?
Because the challenges of the environment inside the person are much more significant than the challenges of a sandbox toy. You have to make sure that the wheels don't injure the tissues in which they drive. You have to make sure that there is no transference of energy or burn to the tissues on which you are actuating. You have to make sure that the transmission is secure so that if there is a problem, you have some redundancy. Otherwise, imagine one of these getting stuck and you can't get to it or get it out. So there's
Which I think has just happened, in fact, actually.
Yes, well, I think you're up against the wall. I think if you just push on back.
All right.
There you go.
Oh, there we go. That was like a 3-point turn.
It was a
That
3-point
wasn't
turn.
actually,
I must say that was quite impressive.
Their size means the robots can all enter the body through one entry point, be it a small incision, your mouth, your nose, or perhaps in the future, an injection. The robots then work as a team, each with a different function. But you envisage them kind of traveling in packs, though one might have a camera.
Traveling in packs, right. So we've had devices of this size that have performed biopsies. So they go in there, they have a little arm in the front that reaches forward and closes and grabs a little bit of tissue and tears it away.
While one of its cousins is actually filming
Well,
it.
right, and you get the other robot on the other side to return that view.
But how many can you have at the same time in a body?
There's not much of a limit. There's really, this much space there, so I can imagine 3 or 4 of them operating very effectively on the inside of it.
And they're getting smaller and smaller and smaller.
They're getting smaller and smaller, absolutely.
And that may lead to a host of possibilities. Completely incisionless surgery. Paramedics able to perform operations at the scene of an emergency instead of at a hospital. Astronauts able to perform medical procedures in space. But that's all still some way into the future. These robots haven't been tested on humans. That may begin next year. So it will be some time before you have a tiny rover wandering your insides. And doctors won't be discarding their scalpels just yet. Shaping our future depends in large part on researchers like these here at the University of Nebraska Medical Center.